Hello and welcome to another edition of the Ask Dr. Pickel show, where we talk about patients and people and issues relating to chronic health conditions, chronic health problems, autoimmune conditions. All right, I'm Dr. Jason Pickel, and if you don't know us, I practice functional medicine. I'm a board certified chiropractic neurologist. All right, so let's dive right in today, and I want to talk about an interesting topic. And we see a lot of this with patients, and more than you would think. But this problem is sometimes it's underdiagnosed or not diagnosed. And this is low blood sugar or hypoglycemia. Hypo meaning low, and glycemia meaning blood sugar. All right, so let's dive right into today's information here. I think you guys will like this. All right, so let's start off talking a little bit about hypoglycemia. And so, the thing about hypoglycemia, or we'll just say low blood sugar, how does low blood sugar occur? What happens? Yeah, sometimes maybe you don't eat enough through the day. That will cause low blood sugar. Well, what's another side of that? Because usually, you're not eating enough. Sometimes maybe you have a diabetic issue already, and maybe you take too much insulin. Maybe you got too much in either you injected too much or you took a pill, and that produced too much insulin and your blood sugar dropped too low. Or, and those are probably the more common reasons the doctors will talk to you about. But another one is very, 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 very common is you're not absorbing what you eat. Meaning you could eat some great foods, you could eat some fantastic stuff, but if you eat something and it doesn't absorb in your gut, then you're going to get low blood sugar. Now, the thing is too, is usually if you have gut inflammation, you'll absorb the easy stuff. You will absorb the sugars and carbs, they'll go right in, but you won't absorb the longer burning fuel, the proteins, the fatty acids, the minerals as well. That shorter burning fuel, those sugars and carbs, they burn quick and they're gone. So your blood sugar goes up. Well, in fact, it goes up real high and then it crashes down. And this is kind of a pattern that can occur. So we've got to look at cause when we talk about this. But, as far as the symptoms of low blood sugar, a lot of people have these symptoms and issues and just kind of tend to live with them. I would say one of the more common ones is just feeling shaky. Noticing even that the hand is shaking. It'll be a faint shake. But some people can get pretty shaky all over even. Feeling kind of nervous or anxious. Yeah, that can be lower blood sugar. When your blood sugar drops, your neurotransmitter production drops. Sweating, chills, kind of that clammy feeling. Some of you have had a low blood sugar drops before will understand this. And it doesn't have to be, you don't have to have all these symptoms. You don't even have to have 3 or 4 of them. You could just have 1 or 2, and it doesn't have to be the common ones. Irritability, what do they call it? Feeling hangry or impatience. Confusion, very common. Heartbeat will speed up, kind of a racing heart. Your body's releasing adrenaline to get blood sugar out of storage into your brain. Feeling lightheaded or dizzy, very common one. Feeling hungry. The thing is by the time you feel hungry, some people say, I'm starving, I'm hungry. Your blood sugar has already dropped. You've already went past the alarm signal. And then nausea can happen. Sometimes people will start to look pale, especially in the face. Let's see here. Feeling sleepy. A lot of people, when their blood sugar drops low, they just want to take a nap. They feel really tired. Feeling weak, just not having energy, kind of just that weakness of the muscles feel like there's nothing left. You just can't even do much at all. Blurred vision. This is a very common one. And it's not a blurred vision that's constant. You may go to the eye doctor and he says, hey, your vision's fine. And then, a few minutes later or hours later, it's like, gosh, it went blurry again. Yeah, this transient blurred vision can be a sign of low blood sugar. The problem is they may change your glasses prescription based upon when it was blurry, and then it can change back and forth. So tingling and numbness, and this could occur in the hands, the lips, the tongue. Even the cheeks, we'll see that occur too. Headaches, very common with low blood sugar, especially when you get them in your neck and your upper back into the back of the head and sometimes over the top of the head, kind of a muscle contraction, muscle tension headache. When blood sugar drops low also, that affects the balance and coordination areas of the brain. So it can cause clumsiness. And then another one can be fainting. So if blood sugar drops low enough, you just pass out. Your brain says, I'm done, shut it off, and you just pass out. And sometimes actually low blood sugar has been related to having nightmares, crying out during sleep. Maybe. I don't see that as often. And also I feel like there's some other possible causes of that we won't get into right now. So let's talk about this low blood sugar thing, and why wouldn't your doctor usually diagnose you with this sometimes too, when maybe you have it or you have all the symptoms of it, and they might look at the blood test and say, hey, your blood test looks normal, your blood sugar looks normal, what are you complaining about? All right, so let's kind of look at this. Okay, so now when we talk about low blood sugar, all right. Basically, there's the first way of looking at things. This is the pathological model. And that would be what your conventional doctor looks at. He or she is going to look at your blood test. They're going to look at your blood glucose and say, hey, is your blood glucose less than 65? If it's lower than 65, it'll say milligrams per deciliter. So if your blood sugar is lower than 65, then your conventional doctor is going to say, hey, you got hypoglycemia. That's too low. You dropped way too low. Here's the problem, though. Most people that are getting below 65, they're passing out. Their symptoms are pretty extreme a lot of times. So the diagnosis can be fairly easy then. Do we ever want it to get that low before we get to diagnosis? No, we're going to talk about some other things. Because, again, if they see this type of low blood sugar picture, again, from a conventional medical standpoint, they're going to think two things. Number one, you have a disease process. Because, again, this is pathological. This is major, major bad stuff. A disease process, or too much insulin, or it could be a side effect of some medication. So that's the way this is going to be looked at. Not really any other way. But how about if you have a lot of the low blood sugar symptoms, but you aren't getting below 65? So then what do you say? What do you do? I mean, you're like, hey, I know my blood sugar is low. I have all the symptoms, or I've got quite a few of those that you talked about. But the doctor said normal. The doctor said you're above 65. You're good. Just keep living life. So we use the functional model. All right. So what does functional mean? So functional means that it's not pathological yet. Let's catch it before it gets there. Let's say on the blood test it takes a 30 to be positive, and you're only at a 28 or a 29. Your doctor may say, hey, you know what? Come back in a few months. We'll recheck it. If it's worse, then we'll do something about it. Well, okay. But from my perspective, I would say, wait a second. We're at a 28 or a 29. It takes a 30 to be positive, and the range is pretty wide. Let's investigate this further. Is this a functional problem? Let's catch it before it gets there. Let's be proactive rather than wait and see. And that's, again, the way I like to look at things. So this functional model really seems to work from the way we use it and like it. Now, again, we use this because there's things that we can do in a preventative way, and things that we can do to deal with it at this level. Whereas if you're dealing with this from this pathological model, What is in your toolbox usually? Medications and surgery. So if those are your only two options, then you're not going to deal with things earlier because you don't have any tools to do that with, which is understandable. So, but again, if you're dealing in the functional model, then you have different tools usually, which include diet, which include nutritional supplements, which include other methods, homeopathy, other methods to deal with things that could cause that functional problem and get it under control. So if I looked at your blood test, I'm not waiting for it to get below 65. I don't like to see it less than an 85. So if you have a copy of your most recent blood test and you look at that glucose number, it's below an 85. Yeah, that shouldn't happen. And some people say, oh, well, I fasted, it'll drop low. No, actually what should happen is when you fast, you might drop a little, but you should still stay between 85 to 100. Why? Because there's backup mechanisms in your body that keep your blood sugar circulating and going to your cells to keep you fed. Otherwise, our blood sugar would bottom out while we sleep every night, and that could be very detrimental to everything. So again, it shouldn't drop below this 85 mark if your body's functioning properly. All right. Now, the thing is if we see that, this means that symptoms are typically not major disease process. Again, we want to catch things before they get to that point. So we're not in a major disease process. And then typically symptoms resolve when you eat. So if you're like, hey, I feel shaky, I feel headachy, but after I ate lunch, back in action again, feeling great. Very common thing. This is more of functional hypoglycemia, functional low blood sugar. So, but again, we don't want roller coasters. We don't want these drops in blood sugar. You should be able to go for a period of time without eating, which we do every night where we're sleeping. And so again, if your body's having to struggle to get blood sugar to your body and to your brain between meals while you're sleeping, or while you're not eating through your day, because you just don't like to eat breakfast or lunch or dinner or certain meals, then yeah, this can be a problem that we can address. So now there is one more type here that can fit into this. And in fact, let's see here. If I can just put it up in this box. It's called reactive hypoglycemia. Okay, so when reactive hypoglycemia shows up, we're going to not only see this low blood sugar, but often there's another lab test that'll be on your lab sheet, and it'll be called LDH, lactate dehydrogenase. It's an enzyme, but when that enzyme drops low, usually less than a 140, this is a sign of reactive hypoglycemia. But what are the symptoms of that? Well, it looks like I've got something covering up here. Let me see if I can fix this here real quick. The wrong thing. There we go. All right, so reactive hypoglycemia. Now, typically with reactive hypoglycemia, what we're going to find is you eat your meal and you get low blood sugar symptoms within 4 hours after eating. After eating. So this is where you just ate a meal. It was great, fantastic meal. Now I feel tired. Now I feel shaky. Now I'm getting a headache. Now my vision's blurring. This is called reactive hypoglycemia. Now this has other mechanisms too, And again, the problem with low blood sugar overall in the big picture is it can get worse and turn into more of a diabetic scenario, because if you're not getting enough fuel and if you're not getting enough blood sugar, then anytime you do eat, your body's going to say, I need more, emergency. So as soon as he or she eats some meal, cause a tidal wave of insulin, get that blood sugar into those cells as quick as possible, and then take a bunch and put it into storage too. And the body will start to deal with it from its perspective, which is not good, because then we start to get a lot of storage building, which can cause increased weight gain. We start to get these blood sugar fluctuations with spikes. We get more insulin release, which is inflammatory, starts to lead to insulin resistance, which is pre-diabetes. And then we can start to go into metabolic syndrome, diabetes, all these other things. So one can turn into the other. But again, we don't want this low blood sugar occurring. So I hope this gave everybody kind of a good definition, some good information about hypoglycemia or low blood sugar. And let's see if we can back to this. All right. And let's see here. Also, if you could share this information, if you could subscribe to us on YouTube, like us on Facebook, tweet us on Twitter, do all the great things there. That would be fantastic. I hope everybody has a wonderful day and like this information, and God bless, and I will see you next time.